IV solution calculations are one of the most commonly tested questions in the pharmacy board exams. Here I like to present the key concepts for IV solution calculations, specifically focused for IV infusion calculations. So let's start. So here the key concept would includes flow rate, IV calculation flow rates, which is measured in milliliters per hour, and then drip rate, which is measured in GTT per minute, that means drops per minute, and infusion time, time to infuse the IV solution, and then total volume, how much volume required to infuse certain time, or time is given or volume is given, how long it takes to infuse that volume. So both type of calculations can be calculated by using these concepts. So first let's start the concept of flow rate. The flow rate is measured in milliliters per hour. So what is that flow rate? Flow rate is the volume of IV fluid to be infused in 1 hour or per hour. So in an hour, how much volume of IV is infused? So that is measured as the flow rate. So the flow rate formula is total volume. Generally, that volume have to be measured in milliliters, and then time, the time that is taken to infuse that volume, that is measured in hours. So therefore, the unit for flow rate is milliliters per hour. So let's start with a simple sample calculations. An IV solution of 1 liter is to be infused over 8 hours. What is the flow rate in milliliters per hour? Here there is options: A 100 mils per hour, 125 mils per hour, C 150 mils per hour, and D 200 mils per hour. So you can pause the video and calculate and let me know what is the best answer. So here the answer is B. So let's see how we got this answer. So as you see, the formula for flow rate. Flow rate formulas include volume by time. So here answers are given in milliliters. So therefore you have to convert this liter to milliliters. So that's a step one. So 1 liter has 1000 milliliters. So the flow rate formula is volume, that is a 1000 milliliters, and the time, that is 8 hours. So if you divide 1000 milliliters divided by 8 hours, it gets you 125 milliliters per hour. So therefore the answer is 125 milliliters per hour. So here next, let's go to the drip rate, or also here you can also calculate drop factor. Drip rate is measured in drops like GTTS per minute, whereas drop factors are given drops in milliliters. Those are the fixed amounts. So let's look into the sample calculations. Or before we look at this sample calculation, here first let's look at the formula for the drip rate. The drip rate formula is volume times drip factor and per minute, or depends on the question. So the unit here is drops per minute. So most commonly, the units for drip rate is drops per minute. Here is a formula for calculating drip rate. Drip rate is measured by drops per minute using IV tubing with specific drop factor. So drop factor can be depends on the tubing. So we'll see in the next slide more about drop factors. However, the drip rate formula, which is measured in GTT per minute, that means drops per minute. So that is measured by total volume in milliliters multiplied by drop factor, that will be given to you for the calculation, and then time. Time have to be in minutes because the drip rate is measured in drops per minute. So let's look at example calculation. Before that, let's me go over details on drop factors or drip factors. The drop factor is the number of drops delivered in 1 ml. So 1 ml contain how many drops? By default, which is for water, 20 drops per ml. However, there are drop factor can be depends on the tubing that is used for IV infusion. Common drop factors are 10 drops, 15 drops, 20 drops, or the macro that could be 60 drops per ml. But you will be given in question what is the drop factor for that particular IV. So let's see the calculation on drip rate. A medication is to be infused at 100 milliliters per hour using IV tubing with drop factor 50 drops per ml. What is the drip rate in GTT per minute? So here are the options. A, 15 drops per minute. B, 25 drops per minute. C, 20 drops per minute. And D, 30 drops per minute. So pause the video and calculate this one. The correct answer is B. So let's see how we get this B. So we saw before, formula for drip rate is volume. That is, volume is given here, that is 100 mils per hour. And the drop factor, that is GTT per mil, 15 drops. So here, since this is given per hour, so answers are always in the minutes, so therefore you have to multiply with 60 because 1 hour has the 60 minutes. So if you do this, if you plug in these numbers, you will get 100 mils per hour, which is here, and drops, which is a 15 drops per mil, and converting hours to minute, that is 60 minutes. So if you calculate this, and then you get 25 drops per minute. So that's your answer for drops per minute. Let's go to the next one. Next question is about time to infuse or infusion time. That means total time required to infuse certain specific volume of the IV fluid. How much time need to infuse? So that can be calculated by using these formulas. The formula for infusion time is total time required to infuse certain volume is calculated per hour. So time per hour equals total volume. Volume have to be in milliliters, and then you take flow rate, that comes as a milliliters per hour. So if you take this formula and then you can calculate time that required to infuse any volume that is on to administer. So here in question, how long will it take to infuse 500 milliliters at a rate 50 milliliters per hour? So let's see the options. Option A, 5 hours. B, 8 hours. C, 10 hours. D, 12 hours. The correct answer is C, 10 hours. So let's see how we got it. So here the formula for calculating infusion time. Time in hours. So total volume, which is here 500 mils, and rate of the infusion is 50 milliliters per hour. So therefore, you simply divide 500 milliliters divided by 50 milliliters per hour. So mils cancels, and then this would be 10 hours. So that's your answer. So answer is 10 hours. Next question is about how do you calculate total volume that is infused. A patient is receiving IV fluid at rate 150 milliliters per hour. If the infusion runs for 6 hours, what is the total volume infused? A, 600 mils, B, 750 mils, C, 900 mils, D, 1200 milliliters. Calculate and find the answers. The correct answer here is 900 mils. Let's see how do we get it. So formula for calculating total volume infused is simple formula, that is flow rate multiplied by time. So obviously flow rate is given here mils per hour. So here this is a mils per hour and the time is 6 hours. So if hour cancels, so you have 900 milliliters. So therefore your correct answer is 900 milliliters. Next questions about the IV admixture. What it means is there are medications added to the IV bag. Means our IV bag may contain solutions such as normal saline or dextrose 5%. Though for those, medications are added to them. So how much medication is added and also how much volume of the medication required to add certain amount of concentrations, like those calculations are used for for IV admixture calculations. Here I like to present three types of calculations. One will be asking to calculate final concentration after adding a drug to the IV bag. What would be the new concentration? Or what would be the dose you would require to get particular concentration? Or also question, what volume would you take it to make specific concentrations? Those type of calculations are used, often tested in the board exam for IV admixture calculations. So here, fun question. A pharmacy technician adds 250 milligrams of drug to 100 milliliters of IV bag. What is the final concentration of solution in milligrams per milliliter? So here the options: A, 0.25 milligram per mil, B, 2.5 milligram per mil, C, 25 milligram per mil, D, 5 milligram per mil. Here the correct answer is 2.5 milligram per mil. Let's see how we got it. So this is the formula for final concentration. Final concentration can be calculated by amount of drug in milligram divided by final volume. So here the amount of drug is 250 milligram. And then final volume here is 100 mils. So if you calculate that, 250 divided by 100, that would be 2.5 milligrams per mil. So that's a straightforward calculation. Next question. A 250 mils of IV bags needs 500 milligram of drug. Basically, it needs 500 milligram of drug. And the vial the drug comes in the vial, contain 100 milligrams per mil. So how many mils will you draw to get 500 milligram? I know it sounds pretty straightforward. Here are the options. A, 2.5 mils, B, 5 mils, and C, 7.5, and D, 10 mils. Correct answer is 5 milliliters. So let's see how do we get that. So you can use this formula: volume in milliliters equals dose in milligram. So here we have a 500 milligram. And here is a concentration 100 milligram per mil. So if you place those numbers in it, so here milligram is cancelled. So two zeros gone. So remaining is 5 milliliters. So that's your correct answer. So next, another question. Your pharmacy received a prescription order of antibiotic 30 milligram of injection stat right away. And the antibiotic available is 2.5% injection in solution. So what volume is needed to fill this order? Like basically you have a 2.5% injection and now you need to take 30 milligrams. So how much volume you draw to get 30 milligram? That's exact question is. So A options is A, 1.2 mils, B, 12 mils, C, 30 mils, D, 25 mils. Correct answer is 1.2 mils. So let's see how do we get it. So this is a very standard a simple method to calculate that is called desired over have method, which is desired, which is the dose ordered. Here desired is 30 milligram and have is 2.5%, and that is basically quantity, amount of the volume. That means 2.5% means what? 2.5% means 2.5 grams in 100 mils. So therefore you have 30 milligrams, and then this is 2.5 grams in 100. So 2.5 grams means you have to make this to 2500 milligram, and this 2500 milligram is in 100 mils. So basically here you have 30 milligram, and then here you have 2500 milligrams, and then followed by that quantity is 100 mils, because that's a percentage. Percentage means in 100 mils. So if you calculate that, 30 by 50, so 20 is gone. So you have this 30 by milligram cancelled, and then you have 1.2 mils. So that's you required to take 1.2 mils of 2.5% injection to get 30 milligram of the drug antibiotic. Next, here I like to go over some mock exam questions, that means exam style questions, how the examiners always tested in the board exams. So first question here is, a hospital required IV infusion of heparin at the rate of 1500 units per hour. So the heparin available concentration is 25,000 units in 250 ml solutions, which is 100 units per ml. So question is asking, what is the mils per hour rate? Means the rate, flow rate. You should set up the pump. A, 15 mils per hour. B, 30 mils per hour. C, 45 mils. And D, 50. So the formula for a correct answer here is A. Let's see how we got the A. So formula for flow rate is volume, total volume over time, hours. So here the total volume is basically, first you have to identify what is the total volume. Here it says 1500 units per hour. That means that's the time. And here total volume is basically 250 mils of solution. And now first step here, you have to identify total volume, that is 250 mils, that is here. And then time, here it says 1500 units per hour. But here you have total units are 25,000 units. So therefore 1500 units per hour. So how long it takes for 25,000 units, which is 250 mils. So if you do the cross multiplication, to cross multiplication you just have to point the arrow to the x or question. So therefore it is x hours. So point the arrow and make sure that the units have to match. This have to be units, this have to be units, and then this have hours. So therefore if you calculate that, and then comes to be time after this would be 16.6 hours. So now you plug in this time volume. Volume is 250 and time is 16.6. So if you do that, it comes to be 15 milliliters per hour. So that's a simple, straight way of calculating this type of exam type of questions. So let's do. Hope these kind of questions definitely helps you and practicing this. Pharmacy prep offer the best exam preparation for pharmacy board exams. So we do practice lots of questions that are relevant to the exam. I am confident after practicing this question that helps you to pass your exams. So let's go to the next question, exam type of questions. So here is 1 liter IV bag is running 20 drops per minute with a 15 drops mils per set. How long will the IV last? So here let's see options are A 6 hours, B 12.5 hours, C 8 hours, D 10 hours. So pause the video and calculate and see what is your best answer is. So here the correct answer is B 12.5 hours. So let's see how we get it. So basically this question is about how long it takes for this 1 liter bag to run at 20 drops per minute. So that means formula for time is total volume drop factor divided by drip rate. So in this case, if you use that, so here 1 liter, which is equals to 1000 milliliter, and then you have drop factors is 15 drops per mil, whereas running rate is 20 drops per minute. So if you do that, it comes to be total 15,000 units divided by 20 units. Basically here you have GTT is cancelled and now you have mils and cancelled and now you have a minutes. So therefore only remaining is 750 minutes. But answers are not given in the minutes. Therefore you have to convert minutes to answer. To convert the minutes to answer, just divide by 60. So if you divide by 60, you get 12.5 hours. So that's the correct answer. Hope this question will be very effective in practicing your questions and answers. Next question is about the IV solution. A vial containing 300 milligrams of ceftriaxone sodium for injection to be reconstituted using sterile water for injection to prepare 4 mils. Basically, you have 300 milligrams of ceftriaxone in 4 mils. How much water for injection should be added to the powder? The displacement value of ceftriaxone sodium is 0.03 milligrams mils per 100 mils. Means there is when you look at the vial of these ceftriaxone antibiotics, the vials do contain powders in it. So that powder volume have to be calculated here. So let's see how do we calculate those powder volume. Then based on the powder volume, you can calculate how much sterile water should be added. So here this vial contain powder in it. So the question here is asking for this powder volume is displacement volume of the powder is 0.03 for 100 milligram. So if you look at the answers, so here correct answer is 3.9 mil. Let's see how did we calculate the answer, that is 3.9 mils. Means you add 3.9 mils of water to sterile water to this vial and then the volume will be 4 mils because 0.9 is powder. So let's see how did we get that powder. For example, the displacement volume means this volume, the space that dissolved powder will occupy in the solution. So that means ceftriaxone, as per the reference, it says 100 milligram will displace 0.3 mils. So here we are using 300 milligram. So 300 milligram will displace 0.03 into 3 is 0.9. And now it occupies 0.09 mils. So 4 mils minus 0.09 mils will give you 3.91 mils of water. So you have to use 3.9 mils of water, add to this vial, and now that total volume here will become 4 milliliters because you also including the powder volume into the calculation. So this is a very frequent question on how to calculate those powder volume. So powder volumes can be variable, depends on the drug. Let's go to the next question. You receive the following order to be prepared in the hospital pharmacy: metoclopramide 12 milligrams in 50 ml, dextrose 5% water. So you need to prepare 12 milligrams in 50 ml with using dextrose 5% water, which is a solution. How many milliliters of metoclopramide injection that present in 5 milligram per ml? So basically you need 12 milligram and you have injection is 5 milligram per ml. So to get 12 milligram, how many mils of this required? That's a simple question. So here are the options: A, 25 mils, B, 2.4 mils, C, 12 mils, and D, 5 mils. So pause the video and calculate and find your answers. The correct answer is B, because here there is a 5 milligram per ml, means 5 milligram is drug is present, metoclopramide is present in 1 milliliters, and you need just simply 12 milligram. So simply class multiply. So if you need how many mils, x mils, point arrow to the x mils and the other arrow, and now it gives you, if you cross multiply this, it gives you the 2.4 mils. Means you draw 2.4 mils from the injection to get 12 milligrams of metoclopramide. So therefore your correct answer is B. Let's look at the last question for this presentation. So here the question is: a physician prescribed vancomycin for 154-pound patient at dose 15 milligram per kg to be diluted in 250 mils. So you have a patient 154 pounds and you first convert that into the kilograms, because this dose is given in kilograms. And this dose is present in 250 mils of normal saline. But the available vancomycin comes as a 500 milligram in 10 mils. So the question is, what volume should be drawn up for administering this patient who is a 154 pounds? So here you have options: A, 3.5 mils, B, 7 mils, C, 9.5 mils, and D, 21 mils. So pause the video and calculate it. Alright, so let's see how to calculate it. First, convert this pounds into kilogram, which is divided by 2.2 pound. 1 kilogram equals 2.2 pounds. So therefore, it gives you 70 kgs. And then 70 kgs per kg is, kilogram is 15 milligram. So multiply 70 times 15. So that gives you 1050 milligrams. So this is the dose that required and present in 500 milligram per 10 mils. So that means you can do cross multiplication. So 10 mils contain 500 milligram. So 1050 milligram is how many mils? If you cross multiply, it gives you 21 mils. So therefore your correct answer is 21 mils. This is your correct answer. Alright, so with this presentation, I hope this will absolutely helps you in preparing your pharmacy board exams. Stay tuned for Pharmacy Prep channel for more videos. Until then, thank you and subscribe Pharmacy Prep.